This is to be continued from the veins video. This is going to be the veins of the lower body, including the abdomen. First, as a little refresher, there's the heart up here at the top of the heart that comes in, and the blue blood enters into the right atrium. This is the superior vena cava, and this is the inferior vena cava. Obviously, it's inferior to the heart. And the inferior vena cava punches through the diaphragm. There's a little foramen in the diaphragm. And it goes through that hole and comes down, 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 down to like your waist. This is all the inferior vena cava. This whole thing. It goes really long. It matches with the aorta. And right next to the aorta, it comes down. And it comes from a split at the waist. And this should look familiar to you because this is really similar to how the arteries are. Now the split at the waist that feeds into the inferior vena cava, that itself shares a bloodstream with two iliacs. So this is called the common iliac. Common iliac vein. And it's common because it shares a bloodstream with two iliac veins. One goes internal like that, and the other one comes down the leg. And the same thing on this side. One goes internal, so that would be the internal iliac, and then this other one that comes down the leg is the external iliac. Now, once it passes up the hips, or the inguinal canal, which is right about here, I'll put inguinal canal. And the inguinal canal is just a canal. It's just a hole in your tissue in the hip region, in the inguinal region, so your veins and arteries can go down through there and get into the legs. And as soon as this external iliac, before the external iliac merges with the internal iliac to turn into the common iliac, it's in the legs. And when it's in the legs, it's the biggest vein that goes all the way down your leg. And this is a biggie. This is the one you need to know, especially in the leg. This is called the Great Saphenous vein. Great Saphenous. And when you have if you have a bypass, if you have any relatives or anybody you know who's had a coronary bypass in their heart, they need to they have to have a vessel transplanted into their heart to bypass whatever blockage there is. And this is the vein that the doctors use. They go in and they cut a piece of this vein out and they put it up in your heart. And that's what a bypass is. So this is the vein that's used. It comes down around in the foot and does a little loop-de-loop. There's veins all in the feet down here, but usually in A&P2 you don't need to memorize those, or you can just look the names up if you need to memorize them. But up on the other side, coming up on the other side for a while, is on the other side, is on the lateral side of the leg, and that's called the lesser saphenous vein. So see, you only need to know one name, and one's great and one's lesser. Now on the other side here, it's the exact same thing. The veins are symmetrical throughout the body, so the great saphenous vein runs up the leg on the medial side of the leg. The medial side of the leg, you know, is the inside of the leg. So that's on the same side as your toe, as your big toe. And then coming up on the lateral side of the leg, the outside of the leg, is the lesser saphenous vein. Now let's go back to the abdomen here. We just have one more big thing to mention on the abdomen. When you come down the diaphragm, when you get inferior to the diaphragm, there are veins that stick out. One sticks out on this side, one sticks out on this side. And where do you think that these veins go? These veins go to the kidneys. Or these veins come from the kidneys, I should say, because the veins are running backwards from the arteries, right? Because the veins are going toward the heart and the arteries are moving away from the heart. So the veins are bringing things in from the kidneys and dumping them into the inferior vena cava. And since these are kidneys, these are veins that are attached to the kidneys, they are called renal veins. Anytime you hear the word renal, think kidneys, because that's what renal means. So you have the renal veins coming in, and it dumps directly into the IVC, the inferior vena cava, which goes up to the heart and dumps out in the right atrium up here. And that's it for the lower body. Oh, you know, one more thing. Teacher might ask you this. Near the lesser saphenous vein, let me get one for bone. Okay, so here's your tibia, your tibial bone in your leg. And then here is next to your tibia on the lateral part is what bone? What bone is right next to your tibia laterally to your tibia in your leg? That is the fibula bone. And so right on the lateral side of the fibula bone near the great saphenous or the lesser saphenous, there's a vein that also runs along here. And you can't see it on the models. You can see it on the muscle models in the bone room, but you can't see it on the flat man models. But this vein runs right alongside the fibula on the lateral part of the leg, and that is called the Fibularis. But you might know it by a different name called the Peroneus. And those are the same things. I don't know how many times students have asked, well, here's the Peroneus, but where's the Fibularis vein? Or here's the Fibularis vein, but I'm looking for the Peroneus vein. These are the same thing. They just have two different names. They're called by two different names. I don't know why. I think maybe Peroneus is the Latin form or something. But the Fibularis, if you remember Fibularis, it's right next to the fibula. So anyway, that's it. That's for the bottom half of the veins. It's really not bad. Of course, these veins are branched off into little tiny veins that extend all throughout the body, but these are the major ones that you need to remember and memorize for your basic anatomy and physiology class.